welcome back to the Barbell Medicine YouTube channel, Instagram, wherever you're getting this from. We are live streaming here on Wednesday, December 19th. I'm Dr. Jordan Feigenbaum with Barbell Medicine. We're doing a Q&A, so if you're on YouTube, you can submit a question. If you're on Instagram, you can submit a question, and we'll try to get to the bottom of this. As far as announcements, we had 2 new articles go up last week, so make sure to check out the barbellmedicine.com website for that. Also had a new podcast with Greg Nuckols that went up Monday, so check that out. It's on iTunes, Spotify, Stitcher, the whole deal. And so if you haven't listened to our stuff or checked out our stuff before, we implore you to do so. And if you're here joining us on Instagram or YouTube, please submit a question. We'll see what we can do. Serena says the podcast was great. Hey, thanks. I had to work on it a bunch. So, yeah, I'm happy with how the audio turned out and all that other stuff. So that was pretty good. So let's see if we grab some questions here. Looks like we are up and running on YouTube. Nice. The one thing that we were talking about earlier was lifting during pregnancy or peripartum, so before, during, after pregnancy. So if you're in our Facebook Barbell Medicine group, you should go on there and check that answer out. It was pretty extensive. Let's see. J-Dub asks, what is the ideal looking curve for the analysis graphs on the templates? So what he's talking about is we have on the templates that we sell, which you can check out over the Barbell Medicine website, we include a bunch of tracking software for you to see what your progress has been like, so how rapidly you're making progress, or if you're declining or something like that. You would not expect your graph to look similar to anybody else's because everybody responds differently to training in general. And then we would expect, or ideally we would like, this sort of steady increase over time, over a long time, so weeks and months and years. If it goes up and down like this week to week, that's not a big concern unless it becomes a trend, multiple weeks in a row. So what you'll see later on in training is that training goes like this and then kind of goes up, kind of this stair-step sort of deal. That's what we typically see. What's the next project, boss man? Trying to get this book, this Barbell Medicine book done. Yeah. That's the next project. What is your opinion on the trap bar as an accessory overload for the deadlift? So I think when you can look at the things that improve strength, so things that improve strength are increased muscle cross-sectional area, increase which works only insofar as you can voluntarily, volitionally contract the new muscle mass in the movement that you're trying to get better at. So just making your muscles bigger but not deadlifting is unlikely to improve your deadlift unless you were untrained before, in which case doing anything will likely improve your deadlift. But the ways you get stronger: increase voluntary contraction of the muscles that are responsible for doing the task, improvement in coordination, which comes through practicing the lifts. The improved force production is specific to the joint angle, joint velocity, contraction type. Also increasing or altering the stiffness properties of the muscles, the tendons, the ligaments, etc., so that you can better express your strength. Those are all ways you get stronger. Now, the trap bar has a different range of motion, significantly different range of motion than a regular deadlift, has significantly different joint angles, which would train force production at different joint angles and muscle lengths. It is the same type of contraction, and it is about the same velocity, so it's kind of related to the deadlift. It's fairly close. It's just not close enough to make it my go-to when it comes to bringing up the deadlift. That being said, if someone's not competing in powerlifting, I think the trap bar deadlift can be useful. I don't see it to be uniquely beneficial for bringing up the deadlift in general. So, all right, let's see what's over on the YouTube before we bounce back to Instagram. Hello, in your opinion, is egg white protein inferior to whey? I mean, kind of. The essential amino acid content of whey per calorie base is usually better, and it's cheaper than egg white protein. So in that regard, I would prefer whey to egg protein, but I don't think that egg protein is bad. So I want to be clear there, and I don't think it's better than whey either. I think if you can't tolerate whey for whatever reason, you could try egg or beef or whatever, but I wouldn't be my go-to protein if I could tolerate whey just fine. Yeah. Let's see. Any problem on surpassing the recommendation of 1 gram per pound of protein intake? Problem like you have some disease process or some bad outcome? Unlikely, unless it tips your calories too high, or you have some pathology that we don't know about. It's just probably not going to help you get better results as far from a weight loss standpoint, from a lean body mass gain standpoint, from a resistance training outcome standpoint. So I don't see the point in doing that. Hey doc, are most internal medicine docs just winging it? I don't think so. It's not been my impression. Maybe when it comes to exercise, sure. Let's see. Man, your training playlist rocks. Thanks as always. Oh yeah, if you're into music, go on Spotify. Find me, Jay Feigenbaum. It's in my link in bio on Instagram. Where can I? Yeah, there's the training playlist. All right. Hey Jordan, is Barbell Medicine whey going to go back on Amazon Prime? Yes, it's already shipped there. So hopefully it's inventoried soon so we can resume giving you a very high quality protein. Yeah, one thing that people, I get the comment all the time that people are like, yeah, I would buy your whey, but I can get this other whey for like $5 cheaper. And I'm like, okay, so let's just consider $5 in the grand scheme of things. That's not a lot of money, to be clear. But I understand that people want to save money, so why would you pick our whey protein over somebody else's? Well, one, we only have 4 ingredients, so there's not a lot of fillers, there's not a lot of binders, gums, etc., or any protein spiking, which you cannot say about virtually any other protein manufacturer. Also, we're CGMP certified, which a lot of others are not. And so our whey protein isolate that's sweetened with stevia with minimal ingredients has the best essential amino acid profile out there on the market. There is not somebody who's doing the same thing that we are at the same price point. So I actually cannot justify recommending another protein, even if you're going to save $5 for the given amount, because you're getting an inferior product. Now, will that give you inferior results? Maybe not, but what I'm getting at is that by giving us your business, you are supporting our broader aims to provide high quality information to people, is basically funding that, so we can get Austin and Derek and Mike and all these other guys and other people associated with our brand to produce good content. So we need, the supplements tend to facilitate that. So I don't think that I could recommend wholeheartedly another protein brand from a quality standpoint, and just saving $5 seems kind of inconsequential to me. Yeah. All right. Hey, finally got my home gym, squat stand, barbell, adjustable bench. I lost this one. Okay. And stackable mats. I do lose cool things like the leg press. Would a fine alternative be beltless high rep squats? You could do that. You could try to rig up a belt squats situation at your place. I think that works. Is it feasible for a smoker, 1 pack a day, to hit plateaus? It's feasible for anybody, regardless of their smoking status, to hit plateaus. Yeah. Let's see. What are the most important principles when it comes to nutrition? Calorie intake, compliance would be the for top 2. Yeah, that's it. Any advice on pulled hamstring recovery? Level 1, I wouldn't do anything about it. I would squat and deadlift and I wouldn't stretch, and I wouldn't do anything. If you're in a bunch of pain, you can ask your doctor about a temporary analgesic, but I'd probably just train. In regards to how it is Hey Jordan, not making weekly gains on the bridge. Can I just add 1 set at the highest RPE to increase volume? I don't know. I would, I guess, want more information. What do you mean by you're not making gains? The weight's not going up week to week. How about every 2 weeks? Is there anything else going on? What's going on as far as like body weight, training motivation, injury, mistraining, equipment issues? Let me know. A lot of fitness people talk about anterior pelvic tilt like it's a huge problem. Could you talk about this and perhaps dispel some myths? I am not concerned with anterior pelvic tilt as either a causal or resulting issue of any thing I would treat, manage, or otherwise change the training recommendation. So I would not routinely measure or screen people for anterior pelvic tilt. I would not adjust their training if they happen to have an anterior pelvic tilt that's past some sort of certain norm that's not defined and unreliably measured anyway. I think if somebody's talking about anterior pelvic tilt in a way that suggests that you're broken or need to do this rehab stuff or whatever, I would fire them, ask for a refund, and go find somebody else. Yes. For someone with chronic low back pain, is it okay to wear a belt on the squat variations that are supposed to be performed beltless? Yeah, it's totally fine. So basically, one of the ways that we control fatigue in some of our programs are that we use a lot of beltless variations, which ultimately reduces the load a little bit, which ultimately can control fatigue, which is one of our big goals. Now, if you have a back injury or some sort of psychological thing that you want to use a belt on all these accessory stuff, that's fine. If that's the only way you can train, do it. That's what I would recommend. If calories are equated between two people and one has more lifestyle stress than the other, would that affect weight loss results despite calories equated? Depends how that affects other things. Lifestyle the stress is kind of, what do you mean by that exactly, and how is that affecting their total daily energy expenditure? But over the long term, maybe, but I would not expect it to, just with the example you gave here. During my last run of the 12-week strength, I experienced acute back pain as a result of doing a new exercise with too much volume and fatigue. Took about 2 months to get back. I'm back on 12-week strength. I don't know if there's a question. I would just say I don't know if that's why you experienced acute low back pain, other than maybe there was a little bit too much fatigue total. So not necessarily just a new exercise, but maybe too much fatigue total. So I would, as always, cautiously introduce new training variables. Cleaning out closets for New Year, threw away starting strength. Their dogmatic teachings emboldened me to hit the gym. Sadly, I have moved on. Well, I don't know if it's sad, that's learning evolution. We just learn more over time. I'm at week 4 of 6 of my training cycle. Missed reps on the last 2 sets of pause bench last week. Decrease weight or take longer rest between sets, or make pause shorter on the chest. Well, I wouldn't change the exercise. That's just changing the goalpost if the bench press is important to you, particularly this variation of the bench press. I wouldn't increase the rest periods. Again, changing goalposts. I don't know how important it is to make the weight on a developmental cycle. It's only important to make the weight on the platform, right? So I don't think I would do that. I would just repeat the weight. Maybe you'll get it this time, but I don't really know your program. I think a program that produces a lot of missed reps is not a good program. Will you do a podcast with Quinn Hennock? I don't see that happening in the future. Yeah. I don't dislike him. I just think that we have people that are saying things that they taught him, and we have similar outlooks on certain stuff, so I don't know why would we do a podcast there. Yeah. Strength and beginning to sorry, that's not a question. Dr. Joe, having trouble retaining information from research articles, you take notes while you read, or just read through and then on to the next one? Yeah, I just read through and on to the next one, and you keep reading the same stuff over and over again, and it tends to stick. Just repeated, the repeated bout effect of learning. No, repeated exposures tend to help there. So, how do you break strength plateaus? Change programming is usually the big one. Yeah. Doc, got some pain while motion in the outer area of my right shoulder rotator cuff. This is not really a question. Any ideas how I can fix it? No, because I have no idea what you're talking about. You have pain out here. That doesn't mean anything to me. Yeah, I would read our shoulder articles. I would go through this sort of self-assessment that we talked about on our podcast on how to manage pain in the acute in the lifter. And then if you're still having problems, I would contact Derek Miles or Michael Ray through Barbell Medicine and set up a little consult for specific guidelines on what to do. All right. Should I be able to add weight to the bar on a week-to-week basis on the 12-week strength program? Maybe. Yeah. I mean, I would expect some sort of regular interval of improvement. And if not, I would start changing programming variables. But week to week isn't necessarily going to happen for your entire training career. It seems unlikely. Does meal timing matter for performance outcomes? Not how people think on a day-to-day basis. Not really. No, I don't think so. When coming back from a back tweak, how quick, large should the weight jumps be? Alan Thrall's story on Instagram made it sound like he made some huge jumps after he started feeling better. Yeah, I think as soon as you're back to normal, you should train normally. I wouldn't exercise any additional caution. No. Jordan, thoughts on neck harness training? If you're in a combat sport, probably some benefit to doing some neck training rather than leave it untrained. But I think most people are usually underweight and undertrained and should not devote resources to neck training. Any experience with a client discovering a brain cyst after a headache caused by heavy lifting? Yeah, well, not a brain cyst. I had a guy who started getting headaches who ended up having a brain tumor, which was benign and got removed and was fine. But the lifting didn't cause any of that stuff. It's just one of those things where increased pressure of any sort. So it could be from defecating, it could be from lifting, it could be from masturbating, it could be from sex, whatever, can cause these folks to have headaches when they have a space-occupying lesion in there. Will there also be a Barbell Medicine bench? I don't think we're getting into the equipment industry. I don't think so. Yeah. Hey, Jordan, how would you manage training for a person with a lumbar osteophyte? I wouldn't do anything different compared to somebody who doesn't have a lumbar osteophyte. Yeah. Without any symptoms that are unique to them. So what I mean by that is I expect somebody who's got a herniated disc, an osteophyte, spondylolisthesis, or any other sort of back pathology to be just fine during any a normal training intervention that we would do for anybody who even didn't have those things until proven otherwise. So and you would know that by the symptomology that they exhibit during the training. I think you had written somewhere that pin press can be substituted with pause bench if you don't have access to pins. Yeah, that's fine. That's fine. Would you ever recommend pumpkin seed protein or another non-dairy, non-meat protein for someone with sensitivities and kosher issues? No. One, pumpkin seed protein, never. Two, I probably would try to assuage any fears about sensitivities, since that's a nebulous, meaningless term used these days, and I think that that's harmful when people think that they have food sensitivities that should affect their life when they actually don't, so I would have to address that. And there are kosher proteins for literally everything out there. Yeah, I probably wouldn't recommend pumpkin seed protein, If you're gonna do vegan style protein, it would be soy or pea protein. Like our pea protein that's coming out, the reason why we picked pea protein, we didn't have access to a good soy protein isolate, so I wanted an isolate. So that's why we started with a pea protein, and then we made the essential amino acid content the same as whey proteins, which is the other big mark against these vegan proteins, that the essential amino acid content is not as high as whey protein, but we made ours the same. So effectively, it's whey protein from a vegan source, which, for people who want a vegan protein, that's great. You'll pay a $3 premium for it, but if that's what you want, you're going to get it from us. Is there any data about SSRI drugs consuming and strength training? Yes, there's no benefit or decrease in performance from SSRIs outside of the management of depression, which tends to improve training. Meaning that if you are depressed and you get treated for depression, managed appropriately, your training outcomes improve. Now, why did you choose family medicine over internal medicine? 'Cause I like babies and I like women. There you go. Jordan wanted to know if your site is going to update the training section on your Barbell Medicine Quick Start Guide. Yeah, at some point. It's just there's a lot of projects going on. And I've been working on this beginner's training program for a while now in multiple different iterations. So it's coming together. I just have had to pull a lot of ideas together and collate them. So maybe January 2019, my friend. Pinching nerve under scapula causes sharp pain. I highly doubt that's a pinched nerve. What exercises can I do to keep strength while don't causes more pain? It's a strange question. I would just press and bench press, chin up, pull up, row. I would basically not do anything secondary to this pain. I would just not think about it, and I would If the exercises make the pain much, much worse, I would try to find a substitution with a different range of motion, different implement, different loading. But if you're having pain at rest, I would probably not change my training based on that. I would see a professional. I recommend Michael Ray or Derek Miles if you need a pain consultation. But given that you have some pain at rest, I wouldn't do anything about it. Yeah. Does whey protein digest faster than animal protein? If you mean by digestion, you mean free amino acids appear in the bloodstream, then yes, depending on the contents of the entire meal, because that affects the kinetics there as well. And it doesn't matter at all. Yeah. Why recommend the conventional deadlift for the general population unless someone's hip is lower than shoulders? I don't understand what that means, because most bipedal organisms have the hip joint below the shoulder joint. I'm not married to the conventional deadlift. I think if you're not going to compete, you should do multiple different types of deadlifts. That being said, just like I'm not married to the conventional deadlift, I don't think that the sumo deadlift is necessarily superior for anything, even lifting more weight. So I think that as far as teaching people how to pull, you can do it multiple different ways. I feel more comfortable with the conventional deadlift. That's what I do. I think it has a little bit more carryover to the squat, and RDL, and other pulling exercises. So those are all reasons why we teach that. How is the app coming along? I think it's good. Yeah, I don't know. I haven't checked in on our guy in a while, which is good. Frees me up to do other stuff. But hopefully, I think it's coming along pretty well. What do you think about muscle mass being potentially used as a vital sign? Yeah, I don't know. I think a marker of health, sure. People are already doing that. I don't know about a vital sign. Yeah. I've been dealing with some shoulder pain for over 3 months now. Feeling much better now, but still some discomfort. Yeah, I don't have any specific advice on that. If you've had pain for over 3 months and it's bothering you, it's not getting better, or you feel like it should be getting better, I think you need to see a professional. And my general recommendation is to contact Derek Miles or Michael Ray, set up a consultation, and talk about this, because likely some specifics in there that need to be sussed out. I'm from the UK, and I buy this based on amino acid profile and the fact that I can handle a whey protein concentrate without stomach issues. That's cool. When using RPE for multiple sets, how do I regulate it? For example, if I lift 5x5 at RPE 8 at 140 kilos and the fourth set is 9.5, should I drop the weight for the last set? I probably would, yeah. Jordan, if this topic doesn't bore you to death, there are some solid studies showing that direct neck work can work as in hypertrophy. I know. Am I still against it? I'm not against it. I think that neck hypertrophy occurs from indirect resistance training as well. The only people who would need maybe direct hypertrophy of those muscles are folks who are going to be in combat sports. Maybe. I think I saw a couple studies where they decreased the incidence of concussions. So that being said, I don't see it as a panacea of preventing head injuries. I don't see it as a very important part of training for people who are relatively untrained anyway. So what should I do if I still plateau even after deload? Change your programming. Yeah. Let's see. In most of your templates, you state that free weights are a requirement. Are we talking about dumbbells? No, we're talking about barbells. Barbells. Any thoughts on tongue to the roof? I have no idea what that is. It's a nice shirt, Jordan. Hey, thanks, man. The Army is including the hex bar deadlift and the new PT test. Why do you think they chose that over a barbell? I think somebody told them that there's less strain on the lumbar spine during a hex bar deadlift than a conventional deadlift. I mean, that's the only thing I can think of, because the hex bar is more expensive, less ubiquitous, Or I guess someone could have made an argument that if they're trying to assess like military-specific strength, that very often they're carrying stuff on the sides of them, and maybe that's more specific. I don't know, whatever. Tyler asks, should the incline close grip press weight be closer to bench or overhead press weight? It's going to be closer to the overhead press. Let's see. Hey Jordan, how can I ease tension in my traps neck? It's appeared out of nowhere and uncomfortable when driving or looking down. I don't know how I would ease the tension there. Yeah. Can coffee ruin your muscle gains? Not even close. The opposite of that. Any suggestions for avoiding neck strain during mid-shin rack pulls that really started after the first 5 reps of a 7-rep set? Yeah, so I would not expect somebody to get a neck strain from any particular exercise. So I think that's just a fatigue issue. If anything, I would have you make sure you're not moving your head around and not clenching on your jaw too tightly. So that. I have some back pain. How soon should I go back to lifting? Now. Don't stop training. Low back pain is not a contraindication to training unless there's a reason that you need immediate surgical intervention. Sumo is cheating, I guess, from an arbitrary sport with arbitrary sized weights with arbitrary movements anyway. So, sure. I've been out of touch for a while. Do you advocate a different novice linear progression than before or have any novice templates? So I think that any template that allows for progressive overload, that does not have a rigid structure, that has a fair amount of exercise variety, rep range variety, and is auto-regulated would be fine for a beginner, provided it doesn't give them too many obstacles to overcome to become compliant, to maintain compliance whilst training. So I think literally any of our templates probably fit that bill if you're into barbell training. If you're not into barbell training, I would suggest anything else. I don't think that the linear progression in general is a good way to program, and I think that very rigid, hyper-specific linear progressions are very bad ways to program if given other options. Jordan, the arguments for squat shoes come off as bro sciencey to me. Barbell Medicine's focus is about evidence-based approach. Is there evidence-based argument to use squat shoes? Yes. I don't know necessarily what you want to talk about in specific, but there are multiple papers on using a elevated heel shoe and then how that affects squat mechanics. Yeah. What to do in my last 2 to 3 session RPs or 9s and 10s when running one of your templates? Drop set RPs. I wouldn't worry. I mean, it's not like something mad, terrible is going to happen at 3, like 3 sessions in a row where the session RP is 9 or 10. The first thing I would do is try to lessen the duration of your next training session. And usually by doing that, you have to manage your rest periods a little bit better, be more efficient on the training. Your session RP usually goes down and the duration goes down, so that means the total fatigue goes down. Jordan, what is your opinion on Alpha Destiny? That's my opinion. Doc, would doing RDLs after heavy deadlifting and pen lay rowing be too much for the lower back? If you're untrained, probably. But if you're well-trained, no. There's nothing that's too much for the lower back. I'm 16 and can't afford a coach or Barbell Medicine template. Do I just do my best learning and trying to program for myself? I guess. We got a lot of free stuff on our website. The Bridge is free, for instance. The General Intermediate program's free. Just train, man. Let's see. I am the regional fitness manager of a gym the regional fitness manager for a gym that I work for has a trainer that talked to me for about 5 minutes, glorifying corrective exercise. Should I bite my tongue or have a conversation with him about it? I don't know if I would have a conversation with him about it, because what are the odds that he's going to change his opinion? Just don't do corrective exercise screening. It's stupid. New study shows that aspartame damages neurotransmitters in rats. Is Diet Coke truly wasting my brain away? No. We've tested that directly in humans, and there's no effect. So I don't care what happens in rats unless it happens in humans too. Fixing hip impingement pain. You don't have hip impingement, and that's not where your pain comes from, so that's to begin with. But fixing that pain with more squats because you didn't have hip impingement. Not sure if it's due to doing 1 day of squat a week to doing it 3 times a week. Yeah, I don't know if you still have pain or not, but if it's gone, cool. Or if you just went from doing 1 day of squats per week to 3 days per week, and you now have some hip pain, that sounds like a fatigue issue to me. Any events planned for St. Louis? Yeah, we have a seminar coming to St. Louis. I think it's in September, as I recall. I'm not going to compete solely general strength conditioning purpose. Is it essential to hit 3 to 5 rep range for acquiring most of strength benefits? Currently, most of your work is done 6 to 10, above 70%. So if you want to get better at doing 1 RMs, then you need to do singles and 3s and 5s and stuff like that. Or if you just want to get better doing 5s, do 5s. If you just want to get better in the 6 to 10 rep range, just do 6 to 10. There's some transfer to either side to lower reps and higher reps. But the biggest benefit you're going to get is the rep range that you're training at. If it was me and I was training just general strength conditioning, I'd do some sets 3 to 5, I'd do some sets 6 to 8, I'd do some sets 12 to 15 or maybe even higher. I'd do a little bit of everything. Jordan, can you suggest some books besides Starting Strength to increase my insight into lifting and barbell training? Sure. Science and Practice of Strength Conditioning. I think it's Zatsiorsky. The second edition is pretty good. Bondarchuk's Transfer of Training is pretty good. Science of Running is a good book. Strength is Specific, another good book. Are you guys going to come to the UK anytime? Yeah, I don't know. Maybe in June. Many vegans claim that animal protein can lead to osteoporosis in the long run. Citation desperately needed. Those who consume the highest amount of animal protein have the lowest incidence of osteoporosis, especially dairy protein. So, yeah. Hey, Jordan, opinions on Athlean X. I do not think that he mixes science with anything. Pseudoscience. Bullshittery. Do you have any strength training related disagreements with Mark Ripito? Maybe. Maybe. But they're not our enemies. We're all trying to get people stronger. It's cool with me. We just disagree on programming and how to communicate that effectively with large swaths of the population. How crucial is it to lower the weight and increase the volume to rebuild work capacity during post-meet training? Extremely important. Is there any way to change the weight from pounds to kilos in the bridge version 3? No. I'm working on a solution to that, but there's no solution that I can convey to you over Instagram. Sorry, my friend. Doctor, I almost never use a belt when training. Can I carry that way getting stronger? Sure. You're going to want a belt at some point. I would just, get a belt if you're serious about strength training. Do you have a general rec for when to switch from strength to hypertrophy and vice versa? Completely up to the lifter. Is there an indicator that you look for that would make switching valuable? So I think any good strength conditioning program should develop hypertrophy. If it doesn't, it's not a good strength conditioning program. So I prefer concurrent periodization, so chasing both of those things at the same time. Would 9 consecutive sets with 3 minutes rest of any compound exercise produce more hypertrophy than performing 9 sets spread out throughout the day? Yes. Jordan, I know we haven't spoken much lately, and I know you miss me. Just wishing you a big, excellent holiday. Bring it in. We're hugging. Embrace. I have a kidney transplant. This makes things like protein intake and the amount of weight gain complicated. How do I find a doctor who can give me advice regarding this situation? I think your doctor, if you probably have a nephrologist, and they're probably giving you the correct information. You shouldn't have a high-protein diet. That's probably true. Jordan, opinion of Jason Blaha's ice cream fitness program. I'm unfamiliar with it. What do you think of hyperextension or back extension exercises? Are they even useful? Sure, for strengthening the erectors and glutes. Sure. Jordan, thoughts? Rerunning LP after vacation to quickly go to past weights. I would never run rerun the novice linear progression. No. Can belt squat stand in for leg press RDLs on the time crunch template? Sure, if you like. Hey, Jordan, you are great. No, Morton, you're great. Jordan, if someone goes from a desk job to a more manual labor job, would you consider that as a spike in fatigue and programming should be adjusted for this? Not prophylactically. I think in 2 or 3 weeks you'll be used to the manual labor job, and ultimately I wouldn't do anything about it. Yeah. What are your thoughts on the power clean for general strength training? I think that the power clean for getting stronger is not a good exercise. Here's why. The power clean is specifically selecting for high velocity force production. High velocity force production, which means it's the higher the velocity, the lower the amount of force you can actually produce. Okay, so low load, high velocity, that's how you train for high velocity force production. I think that for most folks who want to get stronger, gain muscle size, et cetera, they're talking about getting stronger in the deadlift, the squat, the press, the bench press, and the power clean does not transfer over well to any of those things. If somebody really likes the power clean, it makes getting out of bed in the morning worth doing, and they want to get stronger in the power clean, guess what they're going to have to do? Train the power clean. But I think the transfer to the deadlift is pretty low, given the type of the speed of contraction. Yeah. Do you think the Paul Horn low bar stretch is effective for helping someone get better into position over time? I think that gradually exposing somebody to the low bar position helps them tolerate that low bar position. Yes. Would you consider doing a podcast with Steffi Cohen? You seemed aligned in terms of content. Well, it's funny. So she had blocked me originally, I think it was 2 years ago, maybe longer, 3 years ago. But she recently unblocked me, which I thought was cool. I mean, going through the process of unblocking somebody, that's cool. Could do like a Hebrew Hulk podcast. Yeah, maybe. I don't know. Her latest post about this knees caving in or knee wobble in the squat, I think I'd like most of it except for the bit on pain. So I don't know. I don't know if we'll do a podcast, but I would be more open to it now than I would have been 6 months ago. Jordan, what about the argument that you are sacrificing core strength gains when using a lifting belt? That's completely made up bullshittery. So the amount of force production by the trunk muscles during a lift with a belt with the same load is higher than the same lift without a belt. So you're still activating the same amount of muscle mass, more amount of muscle mass with the belt than compared to without a belt. It also improves lifting mechanics, so the bar path's a little bit better, and the velocity of the movement's a little higher with the belt. Those are the only things that change with the belt. So, let's listen to science on this one. Restocking t-shirts are restocked right now, man. What do you think about paleo and powerlifting? I mean, if the paleo diet is the way that you want to get your calories in, that's fine. It's not a healthier diet. It's not going to make you live longer. But if it helps you be compliant with the amount of calories you need and you're hitting the right amount of protein, I think it's fine. I don't find it uniquely beneficial for anything outside of individual compliance preferences. So there you go. Thoughts on Grayskull LP? Me. Why is overextending your lower back dangerous? It's not. Yeah. What does that even mean, overextension? Intra-workout shakes, what do? That's not a question. You just typed 2 words and put a question mark after it. I wouldn't recommend an intra-workout shake for most folks. I don't think it's helpful. So, would it be advisable to incorporate sumo deadlift as a volume movement into your 12-week strength? I don't think so. If you're a conventional deadlifter and you're trying to get better at the conventional deadlift, I don't know if doing a bunch of work sumo is going to help. Yep. Similar to the power clean, would you say the same things about box jumps? Yes, I don't think that people should do box jumps if they want to get stronger in the squat, bench, deadlift, press. Yeah. Long time no see. Ran into Austin at Iron Asylum a while back. Any plans on coming back to Hampton Roads area for a seminar? Yeah, maybe in, I think we were thinking October or November, either trying to go to DC or Norfolk. Yeah. Do you think high bar squats carry over well to low bar? Yes, and vice versa. So, and here's why. It's the same type of joint contraction. So an eccentric followed by a concentric. The range of motion's roughly the same. The joint angles are slightly different. So there's not a 1-to-1 transfer, but still pretty close. And so all of the coordination and voluntary contraction stuff likely transfers over pretty well. Now you compare that to something like, and the front squat probably very similar too, you know. But you start, getting further away, like an overhead squat or a split squat or a step up or whatever. And yeah, sure, there's some transfer, and there's an individual difference amongst folks here, but the further you get away from the movement that you're trying to improve, the less transfer you're going to get, Jordan, I was wondering if you had any thoughts on how I should advise my dad on squat technique. He is a one-leg amputee. Left ankle has no flexion due to the prosthetic. I would try to, if he can squat normal, I wouldn't do anything prophylactically to his squat without seeing him squat. And if he can't squat repeatedly using the same technique over and over again, then I would have him leg press or split squat or box step ups or something like that. Jordan, is it plausible to substitute a scoop of regular monohydrate creatine for your post-workout product on non-training days? You could do that. I'd probably take some beta-alanine as well. Sure. Anybody know how to find out if I'm underweight for my height? Jordan missed or ignored the question, LOL. I ignored it because how could I possibly answer that for you? There's no answer. You need context. Are you a competitive strength athlete or not? How old are you? How tall are you? How big is your skeleton? How well trained are you? There's no chart for this. There's no even range here. So I can't possibly tell you. And I don't mean to sound short or annoyed. I'm not. I don't want you to rely on some random dude's opinion on the internet for something that's very, very personal, right? It's like you asking me, what should I do with my life? And I'm like, fuck, I don't know. What should you do? Let's see. BMI is garbage. That's not true either. So, gosh. If you're overweight for BMI, I don't think that you should gain weight, Alex. Yeah. Yes. Let's see. How would you calculate the acute on chronic workload ratio based on session RPE? You use the first 4 weeks of training, compare it to the 5th week's load, and go from there. You don't add volume, tonnage, intensity. No, you add the AU, which stands for arbitrary units. That's for each week. That's averaged. You take the previous 4 weeks average of the weekly AU and compare it to the next week's AU. And if it's greater than a certain amount, then the ratio suggests that you have maybe too much acute stress compared to what you previously have tolerated. You're 5'6", 169. You're not underweight or overweight. You're just untrained, probably, Volume times average RPE is arbitrary units. That's in the literature they use time times session RPE. So Henley game always on point. Jordan, how's your week going? It's good. Sick doggy. I gotta go. I'm about to fly out to Oregon to pick up a truck. Yeah. Would you try to maintain volume during a cut as long as possible? Yes, I would probably increase volume during a cut, to be honest. I don't think that the dietary manipulation really has a significant effect on stress unless you think it does and you're noceboing yourself. Yeah. Yep. Any evidence on marijuana? If the evidence on marijuana suggests it does not have any benefits when it comes to performance, why is it considered a PED or on the WADA banned substance list? Is it? I thought it was prohibited. Let's see. Let's ask the Google machine. Yeah, they're prohibited in competition, but outside, they're not. Yeah. Yes. Let's see what they say. Marijuana and cannabinoids, why are they on the list? The WADA prohibited list, blah, 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 has potential to enhance or enhances sport performance. Highly unlikely. It represents an actual or potential health risk to an athlete. Oh, you mean like banning all these performance-enhancing drugs that people are going to use anyway and not allowing them access to a doctor because it's all veiled under secrecy? Sure. It violates the spirit of the sport. Okay, made up bullshittery. Yeah. There's an article they actually cite here. So this article's from 2011. They talk about, it's free. All right, well, It's by so Cannabis in Sport, an Anti-Doping Perspective. You guys can read this because it's free on PubMed. So Cannabis in Sport, Anti-Doping Perspective, published 2011. They talk about why they think it may improve performance, although most of the data suggests it does not improve performance. Yep. Ooh, let's look at this study. It's called Illicit Drug Use Amongst Gym Goers, a cross-sectional study of gym goers in Sweden. And their conclusions. Training at gyms is typically considered a health-promoting behavior. However, our results revealed a slightly higher prevalence of illicit drug use amongst gym attendees as compared to the general population. So they looked at like 2,000 people who went to the gym across 54 different gyms in Sweden, and they compared them to another 2,000 people who didn't go to the gym. So 20% reported having ever used illicit drugs, 6.5% used them during the last 12 months, and 2.5% during the past 30 days. Most common was cannabis, followed by cocaine, amphetamine, and ecstasy. Almost 40% of those who reported drug use had used more than one drug. Wow. Wow. And 5% of the people who used these drugs, cocaine, amphetamine, ecstasy, or cannabis, reported using a performance-enhancing drug. Wow. That's cool. What a cool study. All right. Well, fair enough. Let's see. Favorite type of periodization. Concurrent periodization is my favorite. Yeah. Is apple cider vinegar good for anything in the universe? I don't think so. Jordan, how are we supposed to live our life if you don't tell us what to do with it? That's funny. That's funny. Yeah. Current favorite whiskey. Yeah, that's tough. You know, I think when it gets colder outside, I do go back to that Midwinter's Night Dram from High West. Also, their Yippee-Ki-Yay is good. As far as supplementation, what is the number one product you sell that you would recommend? Whey protein, for sure. Yeah, for sure. Different topic, really interested in the dynamics of altitude training. What do you think of the live at a high altitude and train at low altitude? Yeah, I mean, the living at high altitude or exposure to high altitude training for significant periods of time can certainly expand your red blood cell count, hematocrit. That can be useful in some endurance sports, although you want your plasma volume to increase too, so that when you sweat, you don't become acutely dehydrated and you maintain euvolemic status. So that's why you have to train at places where you can sweat a lot. Yeah. All right, guys, we've been here, guys and gals, we've been here for like almost 45 minutes, so you guys have been great here on Instagram, great on YouTube. I really appreciate you guys tuning in. Hey, do me a favor, your Christmas gift to me, share this with one of your friends who you don't think follows me. Tell them, hey, you need to subscribe to Barbell Medicine, you check this guy out for all of his Instagram lives and content. That'd be very helpful at helping to promote the Barbell Medicine brand. Thanks for tuning in. Catch you guys next time.